Hello, people. So now I want to talk about the difference between the terms lobar, pneumonia, bronchopneumonia, and interstitial pneumonia. So first, this would represent our lungs, and this would represent our alveoli with our bronchi. This is a representation of a lobar pneumonia and where the inflammation is in a lobar pneumonia. So, a lobar pneumonia, obviously, if this is an alveoli and this is a little bronchiole, the inflammation is happening in our alveoli most of the time. So obviously the inflammation spills a little bit to the bronchioles, but the main part of the inflammation happens in the alveoli. And the inflammation covers, if we do an X-ray, the inflammation covers a whole lobe or most parts of a lobe of the lung. So in the clinical practice, if you do an X-ray of a normal lung, the normal lung is translucent, dark. You see the vascular web, but there are no major, in a healthy lung, no major opacities. In a lobar pneumonia, the radiologist will see a dense consolidation. So, a dense So on X-ray, if you do an X-ray, the radiologist will see a dense consolidation. And he will tell you, okay, I see a dense consolidation. It can be this, this, and this. You, as a doctor who is treating the patient, will decide if it is more leaning to pneumonia or something else. So if the patient has an history, a clinical presentation, and if other lab tests tell you that this is most likely to be a pneumonia, and if you do an X-ray and see a whole lobe covered in a dense consolidation, you will probably say, okay, in my differential diagnosis, I think this is probably most likely lobar pneumonia. And this is how this term is being born in the clinical practice. So this is how it evolves. So basically, lobar pneumonia covers mostly parts of a lobe of a lung and is affecting the alveoli if we analyze it histologically. Now, and also, I will say it here, lobar pneumonias most of the time affect younger people, from people who are in their reproductive years, and these people have these people are actually healthy, and in most of the cases it is caused by Streptococcus pneumoniae or pneumococcus bacteria. Then the second pneumonia we analyze is bronchopneumonia. So bronchopneumonia would be an acute inflammation in the bronchioles. So this would be an example of a bronchopneumonia. bronchopneumonia. And as we can see, if this is an alveoli, so if this is an alveoli and these are small bronchioles, the inflammation is in these small bronchioles. On X-ray, this pneumonia will show as these small patchy opacities, and as I represented it here, it often is present bilaterally in the lower parts of the lung. So bronchopneumonia represents on X-ray as patchy opacities on X-ray. So again, if you see this, if you have the patient, if his history and clinical evaluation points towards pneumonia and laboratory tests, and if you have an X-ray like this showing patchy opacity, you can coin it bronchopneumonia. Also, as the bronchopneumonia progresses, so as the disease is progressing, the inflammation catches the alveoli too, and it starts looking as lobar pneumonia. So the progress, bronchopneumonia can progress into lobar pneumonia if the alveoli, so to say, catch fire too. So these pneumonias, bronchopneumonias, we see in older people, and they are most of the time they are secondary. So these patients have already some underlying sickness, risk factor, and so on. It is also caused by Streptococcus pneumoniae, but also by other bacteria like Staph aureus or Haemophilus influenza. This is the basic thing about bronchopneumonia. So the last one that is left is interstitial pneumonia. So this would be interstitial pneumonia presents on X-ray as diffused. So we see that here we have these diffused, bilaterally diffused, hazy opacities. So they are not clear cut, they are diffuse, hazy opacities. Most of the time, these interstitial pneumonias almost look similar like some pulmonary edemas, and they are causing the inflammation is in the interstitium, so in between of the alveoli. The inflammation is happening in the interstitium, in the interstitium parenchyma between the alveoli and the bronchi. Causative agents for interstitial pneumonia have often been viruses, like the influenza virus. So, basically, the lobar pneumonia affects a lobe of the lung and shows as a dense consolidation. Bronchopneumonia is affecting the lobe of the lung, but is showing as a patchy opacity. And interstitial pneumonia is affecting the lung in a way that is showing like diffused hazy opacities. And these are basically, this is the simple division and explanation of these three elements. Thank you.